Distinguished speakers and guests, ladies and gentlemen, thank you all for your participation in this event. Due to COVID-19, mankind faces a new crisis that has never been experienced before. Ultimately, this crisis will pass away too. However, those who survive this pandemic will face an entirely different world. We need to be prepared for that. Global hyperconnectivity powered by ICT and social media has proven to be a double-edged sword. On the one hand, it can stabilize the global response to the pandemic by spreading scientific information. On the other hand, it can easily destabilize and devastate the painstaking efforts to cope with the pandemic by spreading false rumors and fake news. At the early stage of COVID-19, the lack of scientific knowledge and the overwhelming amount of inaccurate and unverified information created chaos and uncertainties in global and national responses, and unnecessarily politicized the local and global response. This exacerbated social instability and resulted in the failure of global partnership and systematic management of the pandemic. We need to be ready to ensure the next potential crisis can be addressed more effectively. This global crisis demands the establishment of a new global governance and crisis management response method that is consistent with our hyper-connected modern society. The new global governance paradigm needs to be designed and operated according to the four core values. First, scientific evidence-based approach. Second, precautionary principle. Third, information transparency. And fourth, information democratization. The information and knowledge sharing platform based on these core values can play a vital role in sharing accurate and practical information for all societies. The new platform we are launching here today facilitates collaboration between health professionals, civil society, and the private sector in responding effectively to COVID-19 pandemics. The platform provides a robust response mechanism that offers professional, non-political, neutral, and practical solutions for health emergencies. The platform accelerates the aggregation of professional information on COVID-19 and facilitates the dissemination of lessons learned from country experiences. The platform enhances global governance for solidarity and raises awareness of root cause through public health reform in the long term. We hope that this platform can elevate global partnership to address COVID-19 through its information sharing capacity and help strengthen health systems in building a more resilient and sustainable future. Thank you for your attention.
Ladies and gentlemen, it is a pleasure to welcome you to the ADB Knowledge Forum for 2021 with the theme Learning Through Change. My name is Swee King and I'm your moderator for the next 1 hour for this session of how can knowledge management be institutionalized. This session will also launch the Ban Ki-moon Foundation and Asian Development Bank case study called Assessment of the COVID-19 Response of the Republic of Korea and introduce to you the knowledge sharing platform from South Korea. I'm pleased to take us through the rest of the agenda, perhaps beginning with Dr. Patrick Osewe to introduce some opening remarks. Dr. Patrick Osewe is the Chief of the Health Sector Group for the Asian Development Bank, and it's my pleasure to introduce Dr. Osewe for a few introductory remarks. Dr. Osewe, the floor is yours.
Thank you so much for the introductions. So COVID-19, the spread was fast and furious. In just a few weeks, it started from being an epidemic that started from one country and spread to the rest of the world. It was a new disease and not many people knew about it. Some countries had experience with previous epidemics and pandemics over the past 3 decades. For example, the SARS pandemic in 2003, the MERS, the H1N1 pandemic in 2009, and the MERS epidemic in 2012 and 2015. So some countries that had that kind of that experience dealing with such epidemics and pandemics. Other countries had not dealt with this for many, many years. And therefore, there was lack of knowledge of how to deal with this pandemic. So for ADB, we moved very quickly and very fast to support our developing member countries. The first, of course, was to provide emergency supplies, basically supporting countries to have the testing capabilities, to have ventilators to save lives. But concurrently, as we are preparing our facility, the $20 billion facility to support COVID, we were also engaged in a lot of knowledge work, basically bringing countries together, experts from countries together to be able to share knowledge, countries that have gone through this in the past, countries that had a lot of expertise. For example, we brought in experts from China CDC, from Korea CDC, from US CDC, from some of our leading institutions in the region and beyond to basically define what are the best interventions to address COVID, where you'll have the maximum impact. Because in an emergency like this, sometimes a lot of wastage because people are doing things that are not the critical issues, critical interventions that will have an impact on COVID. So we spend a lot of time generating such evidence and sharing the evidence with our DMCs. Second, we recognize that in our region, there's no regional CDC. We have national CDCs, but we do not have regional CDCs. So before the pandemic, we had been engaged in looking at what kind of institution do we need in the region that can respond to emergencies in future. And because of the pandemic, we accelerated those discussions, and an agreement was reached to establish ASEAN Centers for Disease Control, basically as they call ASEAN Public Health Center for Public Health Emergency. And that has now led to a situation whereby going forward, starting from perhaps next year, there's been a lot of discussion. The government of Japan has contributed $50 million to establish a center like that. And 3 countries are being considered: Thailand, Vietnam, and Indonesia. So we have been involved with McKinsey and various developing member countries to look at how should that CDC look like in our region that reflects our regional collaboration, cooperation, and so on. 3, we work very closely with the British Medical Journal. The British Medical Journal has a network of members from all over the world, and they're constantly updating the journal. So we established what we call the Information Center, whereby every day it's being updated on the latest information about COVID treatment, diagnostics, and also vaccines. So ADB has played a very, very central role in terms of bringing DMCs together, sharing knowledge, and also at the same time supporting countries. For instance, in India, we established through our TA a center that coordinates the entire effort, pandemic effort in India. And this was very instrumental when there was a significant crisis. So I have to say that we have learned a lot in the process. Our DMCs have learned a lot, and we have seen the value of knowledge going forward. If you have the knowledge, you can confront any epidemic and any challenges that you have in the health sector. And I think collaboration with countries like Korea that have done an excellent job in this regard is very useful. Thank you very much.
Thank you, Dr. Seve. These are excellent remarks about the knowledge work that ADB has done with developing member countries, for regional CDC in Southeast Asia, and also the Information Center with the British Medical Journal, following on from the excellent opening remarks from Mr. Ban Ki-moon, who chairs the Ban Ki-moon Foundation. I'm very pleased right now to invite Ambassador Ray Kwon Chung, who is the board director for the Ban Ki-moon Foundation for a Better Future. Ambassador Chung will share some thoughts about the case study from South Korea and also show us the knowledge sharing website. Ambassador Chung, the floor is yours, sir.
Yeah, thank you very much for the introduction. And it is a great pleasure that I can join with the ADB at the Knowledge Forum to share the experience of Korea, as well as the results of the collaboration between Ban Ki-moon Foundation and the ADB, which was the project was headed by and guided by Dr. Susan Ross, and it has been extremely productive and fruitful. And I will introduce the outcome of the collaboration in a few minutes. But before I do that, I would like to briefly introduce you about Ban Ki-moon Foundation, which was founded about 2 years ago. After Mr. Ban has finished his term in the UN in 2017, and then 2 years later, we set up this foundation for a better future. Actually, it was just less than a year before, like about 7 months before the COVID-19 striking the whole world. So this foundation was founded for a better future, but unfortunately, we didn't expect it, but we got a very strong strike from the virus, which was hitting the whole world and threatening our future. And then this is why that we have been thinking about how the Ban Ki-moon Foundation can make a contribution in stabilizing and also giving some knowledge support for the response mechanism for the global response. And this is the reason why we have approached ADB, and we have proposed some ideas that Korea Ban Ki-moon Foundation would like to share our Korea's experience, as well as we would like to establish a professional, non-politicized expert platform to disseminate the most scientifically sound and the solid information to help developing country member states all around the world, because we have seen that the global response has been often paralyzed by the politics. And it was one of the most unfortunate situations. And we felt the foundation like BKM Foundation, the Ban Ki-moon Foundation, can play a very important role to bringing in non-politicized, neutral, and a professional platform to support the whole world. And then I really appreciate the ADB's recognition and acceptance of proposal, and we have been working almost last 17 months, and now we are at the stage of can showcase the results. So this has been the background, and I'd like to make a short my own observation about what has been the success factor. Why Korea, unlike other countries, we could have minimized the confusion that the COVID-19 has struck all countries around the world, whether developed or developing. Even the developed countries are not the exception. They were also confused in coming up with effective response mechanism. And but Korea, luckily and fortunately, we do not have to resort in complete absolute lockdown or absolute close down of the border. We have been maintaining quite the flexible measures to keep the borders open and the flow of the people still possible. And even our normal life can go on a little bit restrained, but almost like 80 or 90% possible normal life. So why this kind of difference has happened. So this was the reason that I'd like to share with you the background. I'll make it just very brief here, that this simple slide shows that how Korea was, in fact, was not always fortunate. We have been unfortunate for several instances. We have been suffering the pandemic many years even before, many other countries had that similar experience. I think the ingredient of the secret of the success was that we have been hitting by the outbreak of the virus early on, and we had the initial and early shocks, like from the SARS outbreak in 2003, and the swine flu in 2009, and the MERS in 2015. So all those earlier strikes by this pandemic actually provided us, at that time, we thought that we were very unlucky, and maybe we were quite unhappy about why we were hit while the other countries are not hit. So Korea has never been always fortunate, but we have been hit by this pandemic much earlier than other countries. I think this was the main reason that we had to institutionalize the knowledge and the experience, and we had to come up with the institutionalization and the legal basis, and also, most importantly, social consensus, because we clearly realized that it's a matter of life and death. I don't have time to go through the details of the evolution of our response mechanism. I will simply go down to my conclusions. So actually, I would like to emphasize that social learning by doing, I think that is the main essence of Korea's effective response mechanism, because we did not suffer as much as other countries suffered from the COVID-19 strike, because we already have been a kind of a social consensus, because we have been learning by doing through the SARS, MERS, and the swine flu strike before. So we, as a society as a whole, we became the manager of the knowledge. It is not just the government, not just the business or the civil society, but the whole society had a clear understanding that we have to work together, collaborate together, because it's not a matter of a privacy issue, it's not a matter of an individual freedom issue, but it's a matter of life and death. And everybody agreed that they are concerned about their own life. Everybody is concerned about their life. I was a little bit, from a Korean perspective, and many of us in Korea was a little bit puzzled when we were witnessing the response from the other countries, especially from Western European countries, arguing that it's a breach of privacy or it is a kind of infringement of individual freedom. But it was a little bit strange for us to look at this issue, the response mechanism, from a privacy or individual freedom perspective, whether we thought it is a matter of life and how to respect our own life and protect our life. So it is not the breach of privacy or individual freedom. We had already come up with many of the ideas and the systems and the schemes that can balance the individual freedom and privacy with the social good and benefit of protecting each one of us from the virus. So we have been able to, because based on the social consensus, we were able to come up with a very effective legal basis even for tracing. Later on, Dr. Che will introduce Korea's approach of tracing, testing, and the treatment, 3T mechanism from Korea, or even transparency. But this was all possible because the Korean society had a kind of a social consensus about that this is not about the privacy issue or individual freedom issue, but rather it is a social learning by doing and how to manage the knowledge to protect our society. So this has been, I think, I don't want to read all my points in the slide because in view of the time. So that has been the main, I think, secret of our success. So I will stop about Korea's experience. Then I will show you the platform. Just a moment. I will show you the platform of our Yes, this is the platform we have been working, and we are going to launch from today. And we have 3 items under this. First, where we are. This is about current status of COVID-19 and how to measure COVID-19 situation around the world. And this is how to respond, the database. This is to support the member state, and each developing country can insert their data based on this format provided here, and then they can measure their own situations. So this is a kind of a basis for each developing country to measure up how they are responding. So we would like to provide a kind of tool to measure it. And this is about how to build back better after the COVID-19 is over. So this is about economic recovery, legal basis, public health reform, and strengthening the role of the WHO. And this item, interactive network. This is actually the main essence of this platform, where we are providing a space where the people, anybody from the developing world, the health expert, and anybody can introduce the questions they are wondering, or they want to get an answer. Then they can propose their ideas or the questions here. Then the expert around the world, the professionals, will come up and provide answers for it. So this is actually a space where the health professionals can interact and share their knowledge and the expertise and science informations. And here is about in the professional community. This is about interactive Q&A. This is about it. And the webinar, and this in the professional community is about interactive Q&A. And this is interactive network is about eminent groups, expert connect, and partners. And this is about our platform and our mission and the key messages. Since I have already taken too much time, I would like to stop here, and I will just come up with any question. If there's any question, I will come up with answers for it. I will stop here. Thank you so much.
Ambassador Chung, thank you for taking us through the Platform for Sustainable Health Management Solutions by the Ban Ki-moon Foundation. Later throughout the conversation, we will put the website address into the chat group so that the audience participants will be able to look at the website. Ambassador Chung, thank you very much for your comments also about the South Korea example, notably about social learning by doing. And in the same spirit, may I now invite Professor Dr. Jae-wook Choi, who is a professor in the Department of Preventive Medicine in the College of Medicine in Korea University, who will speak with us about the 3T, test, trace, and treat, and also how did South Korea use the knowledge platform to make decisions during COVID. Professor Choi, the floor is yours.
Hello, everybody. It's very nice to meet you here, especially thank you very much for your kind introduction about me, that course. I'm the professor of Korea University Medicine and the director for the Research Institute for International Cooperation of Korea University as well. So let me introduce the title of my presentation today. So it's just a case study, the assessment of the COVID-19 response of the Republic of Korea. Actually, unfortunately, as you know well, at the present time, it is being too early to evaluate the impact of the COVID-19 in the national levels. We have not enough scientific evidences to evaluate the Korean cases on the national response to COVID-19. And also, nobody knows whose country is the final winner in the fight against COVID-19. We still undergone in the pandemic at the moment as well. So I would like to say it may be the below the items could be the country-specific evaluation criteria for national response program for COVID-19 in the future, not this time. So I will talk about this issue in the last slide of my presentation. The total deaths, the cases from the COVID-19 were about the 4.6 million in the last week. And also among the OECD countries, the South Korea is ranked 9th position from the lowest new confirmed cases, which shows the 29 for 100,000 population. And South Korea is also 0 to 31%, which is ranked the same, the 9th from the lowest rate of the case fatality among each country as well. It's pretty good, the performance of the Korean national response program to the COVID-19. This graph explains the significant increase of the excess mortality in worldwide from COVID-19. In 2020, the reported total deaths were about the 2 million worldwide. However, WHO estimated that excess mortality would be greater than 3 million in this year. In a graph, you can see the many countries, the data about the excess death rate. The United States and the UK, and finally, this is the Korean cases. In the United Kingdom, UK, the excess mortality rates are sharply increased during the early outbreak of COVID-19. However, it shows a gradual increase again in the second quarter of 2021. Compared to the UK, the excess mortality rate of South Korea is relatively much lower and steady state, pretty good. The excess mortality is influenced by the 6 drives of all cause of mortality reported by the WHAME, as you may know, the Washington University, the Global Institute for the COVID-19 estimation, which are these 6 kind of drives. Actually, you can see the last 3, the drives are some factors to reduction in mortality, not the increase in mortality. For example, the injury from the car accident due from the social mobility is decreased, and the mortality due to respiratory infections and some other chronic conditions could be lower than the last year or 2019. In Korea, through the experience of the MERS 2015, we could establish the new Infectious Disease Control and Prevention Act was amended in 2015 to effectively prepare and respond to the existing and the new infectious disease COVID-19. Also, the public sector established a partnership with the private sector to develop the RT-PCR test kit, the quarantine facility, and many other the public measure to come up with the COVID-19 response, the 3T levels. In the early outbreak of COVID-19 last year, the Korean government established the 3T strategy, which stands for testing, tracing, and treatment. The Korean government placed a priority on early detection of the virus through very vigorous laboratory testing and a strict epidemiology investigation. The efficiency of testing was enhanced through the Korea Innovative Drive, through the walkthrough, drive-through, and many other some kind of preparation for the early diagnosis was quite good and very effective in the last year. As of the March 10th of 2021, the 622 public clinics have been installed and operated by the public health center and the medical institution. The screening center is a space where the patient which suspected infectious disease, such as cough or fever, and receive the separate treatment before entering a medical institution. The accessibility of diagnostic tests for patients has been improved at a large scale. rapidly the diagnostic tests have been made possible, and operating models such as the drive-through and walk-through and has also been diversified and operated. For a quick and accurate epidemiology investigation of COVID-19, the Ministry of Health and Welfare of Korea developed a digital customer register system with called KI Pass, a Korean Internet Pass, based on the QR code. This information that can be collected with the KI Pass system and how to use it also follows you can see this kind of the instruction to the website. The right side picture is a live treatment center. It's a kind of the free hospitalization center for the asymptomatic patient. It was quite nice, and more than 100 the treatment center was operating and located in the world nationwide. So it was quite nice, but it also make the big burden to the private sector of this facility. So now, we are changed into from the live treatment center to the home treatment, in-house the treatment system. So we make it now consider to change our system. In many countries of the world, COVID-19 pandemic has negatively impact on the national health system, particularly in developing countries. The achieving UHC, universal health coverage, is regarded as the key priority for not only the SDGs and the prevention of excessive mortality as well. In Korea, all Koreans can receive same health benefits regardless of their socioeconomic status. Within the Korean national health system, Koreans receive zero out-of-pocket payment for COVID-19 treatment, which is supported by the NHIS and the government as well. The Lancet paper right side, the paper shows the power of UHC in the era of the COVID-19 and described the Korean NHIS as the good reference, could be a good reference case of the UHC and the COVID-19 response. Please have a look and see it later. In South Korea, about 43% of the Korean population are fully vaccinated, and 28% are partly vaccinated, the first case inoculation. I'm sorry, so including them all, about 71 of the South Koreans have vaccinated at least once, and the rates are relatively higher among these countries. I'd like to explain the Korea's national response to COVID-19 using WHO's ACT tools model, access to COVID-19, the tools model. The biopharmaceutical industry, the leading role of the private health service providers in the rapid development and use of diagnostic devices and the dissemination of treatment and vaccines. Finally, the leadership of the Korea Disease Control Agency and the Ministry of Health and Welfare in Korea was quite impressive one. In conclusion, I'd like to suggest the future direction of the ADB knowledge sharing platform and some pointer as follows. For the past decade, many parts of the world have experienced some of the infectious disease pandemic, SARS, MERS, and COVID-19. At early stage, due to the high uncertainty of this disease, there is a significant increase of the mortality and morbidity, which also critically impact on the people's life. However, the uncertainty and risk of these diseases are solved or are alleviated gradually by the global collectively intellectual reports and scientific research. However, if a new infectious disease, think about that, if another new pandemic occurs after COVID-19, the disease is also likely to possess another and new uncertainty again. Such an institution may cause a tremendous damage, such as COVID-19 in a world like this. Okay, this is last slide. The development of this platform is very good. It's based, but however, it's based on the database of national and the international agency, blah, blah, blah. So therefore, this platform may not function properly due to uncertainty of the next new emerging disease. In other words, current platform will need to become a dynamic model that can be useful for developing alternatives during such uncertainty. In order to prepare to respond, come up with that issue, uncertainty. So we have to use the AI or big data to using that one to surveillance and monitoring and forecasting more effectively to the future risk again. Therefore, so ultimately the next challenge for this project will be more accurate diagnose, monitor, surveillance, and forecast new disease outbreak with uncertainty. Thank you very much.
Professor Choi, thank you so much for sharing with us the South Korea story from an epidemiology, public health, public-private partnerships, and also a knowledge management perspective. We're very grateful to you. Ladies and gentlemen, before I move on to the next speaker, Dr. Tanya Kuchenmüller from the World Health Organization, may I invite you to write your questions in the chat group, and later, when the opportunity arises, I will be selecting some questions for us to ask the panelists. So again, I invite you to please write your questions in the chat function. I'm very pleased right now to move on to the expert panel discussion. And during this expert panel, with your permission, I would like to focus on two speakers, Dr. Tanya Kuchenmüller from the World Health Organization and Dr. Arun Dutta from the Asian Development Bank, with a little bit of time given at the end to Ambassador Chung and Professor Choi for any additional new thoughts. But the focus right now shifts to Dr. Tanya Kuchenmüller, who is the unit head for the Evidence to Policy Impact Unit in the World Health Organization. Dr. Kuchenmüller, it's a pleasure to have you. Allow me to share a prompt with you that to date, we have about 620,000 papers on COVID-19 alone. How does your unit, the Evidence to Policy Unit in the World Health Organization, support countries to manage such a large volume of knowledge and research, especially like Mr. Ban Ki-moon has mentioned, that there are rumors and also fake news? Dr. Kuchenmüller, the floor is yours, and thank you for your answer. Over to you.
Thanks very much, Si-Kwang, for this highly relevant question. And again, my great appreciation to the Asian Development Bank for the invitation to this important session. These that implicitly in your question were also mentioned are particularly pertinent during COVID-19 times, but pose in general a challenge to policy making. Since you specifically mentioned the unit and we're inquiring about it, the Evidence to Policy and Impact Unit that I'm leading in the World Health Organization, let me briefly explain that its mandate is to support WHO member states in strengthening and institutionalizing country capacity in research to policy activities to scale up impact and the achievement of important health goals. One of the key initiatives that we have in WHO is the Evidence Informed Policy Network, EVIPNet, which is a global initiative embracing cutting-edge approaches to knowledge translation for better health policy making, which supports more than 50 countries worldwide in leveraging the best available evidence to deliver high quality and effective healthcare policies and programs. More specifically, EVIPNet is promoting the establishment or strengthening of knowledge intermediary organizations. We call them knowledge translation platforms, composed of researchers, policymakers, and other relevant stakeholders. And they serve, just as Patrick Oseva was presenting earlier, as research advisory bodies bridging the research policy gap at country level. During the COVID-19 pandemic, the spotlight was put onto these national advisory bodies as playing a key role in supporting the development of national COVID-19 responses. Making the direct link again with your question, Si-Kwang, these national advisory bodies are also playing an important role in dealing with the 4 V challenges of high volume, velocity, variety, and veracity. When we have a look at volume and velocity, now more than ever, and especially in the context of COVID-19, decision makers have been confronted with a deluge of evidence, both reliable and unreliable, which can be paralyzing for decision makers and citizens alike. So policy decision making often occurs within extremely short timeframes, as we know, even shorter and more urgent in times of crisis. And acknowledging the tension between rigor and speed, knowledge translation platforms can respond to urgent requests from decision makers by providing relevant and high quality evidence in short period of times. In other words, if those advisory bodies, the knowledge translation platforms, if they have the capacity, rapid response services can be activated so that in short timeframes, between 3 and 30 days, the best available evidence can be provided. And just to emphasize again that these rapid response products are developed based on systematic and transparent methods to ensure that they really provide the best available evidence to inform decision making. So precedence is given to systematic reviews and rapid reviews when possible. Furthermore, to stay abreast with the constantly changing landscape of evidence, living evidence synthesis have become popular during COVID-19, meaning evidence that is constantly updated with the latest scientific results. Alternatively, if countries do not have the capacity or resources to undertake living evidence synthesis themselves, EVIPNet has established collaboration with other initiatives to create synergetic effects across the evidence ecosystem, such as with COVID-19, that regular updates, living evidence synthesis globally, or of course also WHO has played a key role in developing rapid evidence synthesis and up-to-date technical guidance and guidelines on COVID-19. And my congratulations also to the South Korean knowledge platform launched today, which brings together, as we have heard, scientifically sound, unpoliticized data, research and lessons learned to inform decision-making, which is providing reliable evidence, exactly what we would need for supporting countries in taking decisions and formulating an effective COVID-19 response. These global evidence synthesis or information sharings, however, need to be adapted to the local context. Otherwise, they're not actionable and meet the local needs and specificities. And here again, the evidence advisory bodies or knowledge translation platforms come into play to enhance uptake and implementation at local level. This leads me to the two remaining B's, the variety and veracity. Uncertain, conflicting and shifting evidence has also been considered a considerable challenge during COVID-19, as we have seen. And the knowledge translation platforms, they can filter the current best available evidence from unsubstantiated sources and combine the results of multiple relevant studies and evidence sources. So systematic and rapid reviews, primary studies, local data, and tacit knowledge, while taking into consideration the quality of the studies and biases in existing evidence base. So in a nutshell, these advisory bodies are uniquely positioned to serve as credible hub if they have the capacity that provides trustworthy evidence and can act upon by policymakers, stakeholders, citizens, and media in times of crisis. For this to happen, the knowledge translation platforms need to be based on transparent and systematic processes and other key principles of inclusiveness. KTPs also provide a forum, and we have seen that as highly important during crisis situations for collaboration and shaping a collective response through multi-sectoral actions. They bring together the different stakeholders from different sectors to identify policy problems, increase mutual understanding of challenge faced, deliberate about policy and practice solutions, including their benefits, potential harms, costs, and uncertainties, and discuss also implementation considerations. I would say that what has become very clear and a key lesson learned of the pandemic is not only that these knowledge brokering organizations play an important role in crisis situations for all of the points that I've just mentioned, but these kind of structures take time to be developed. They do not, cannot be established in crisis situations ad hoc, but require longer term investments and need to be built prior to a crisis. It's not during, as I was just saying, a crisis that these can be mobilized. And we have also seen from the Korean case study, which was just presented, that structures and processes have to be at least in parts already in place, building on experiences such as SARS and MERS to be then activated rapidly as needed. What has also become very clear is that in order to realize the full potential of evidence to policy partnerships in view of increasing returns to policy decisions, donors must implement new funding models that redistribute power away from their own institutions and agendas. So wanting to have quick wins, for example, pushing their own evidence or guidance to the country level to demonstrate impact instead of long-term relationship building centered around the context, questions and priorities of government policymakers is a misaligned incentive. We will further elaborate on all these issues that I've mentioned during a WHO Global Evidence to Policy Summit. We are virtually organizing from 15 to 17 November, where we're looking at the lessons learned on research to policy mechanisms and government structures during COVID-19 to really ensure that we capitalize on the experiences, innovations learned from the challenges for building forward a more resilient, equitable and sustainable world. ADB's Knowledge Advisory Service Center is supporting the organization of this event, and I would like to express a warm invitation to this panel as well as to the audience to attend the summit. And we would be delighted also to feature the Korean COVID-19 experience, including the new knowledge, the new knowledge platform at this event. So thank you very much for the opportunity to contribute to today's session. Thank you.
Thank you, Dr. Kuchenmüller, for taking us through the solutions for the 4V challenge of knowledge, and also telling us about how knowledge is power only if it's translated into meaningful and actionable policies. Very pleased to have you. And if I may move on to the next speaker, Dr. Arin Dutta, who is a senior health specialist at the Asian Development Bank. Dr. Arin, it's a pleasure to have you here. What are ADB's knowledge management strategies in the endemic phase of COVID, especially as since we have to shift our COVID responses away from short-term campaign mode towards long-term routine mode? How is ADB's knowledge management strategies going to evolve? Dr. Arin, over to you.
Thank you, Swee Keng. So many great ideas in Dr. Kuchenmüller's remarks. I think I can try and build on that. So I appreciate the opportunity to speak about ADB's knowledge work and how we can adapt to what is being called the endemic phase. So I have 3 points, but first some quick background, just building on previous speakers. So Patrick, I think, mentioned at the beginning how ADB adapted to the challenge of knowledge operations during the last phase of the pandemic. Information is a potent tool, right? So in our arsenal, it is needed everywhere. It's needed in myriad forms. And many of our developing member countries had not been impacted by SARS in early 2000s or experienced a similar nationwide health crisis. So they needed support to prepare. Knowledge needs were pretty acute, and the means to articulate those needs were scarce, let alone fulfilling them in a contextual, culturally specific way. So ADB did 2 things, and first of these is through partnerships we made with different organizations and with rapid engagement methods with experts and consulting firms, we delivered a lot of information to users. It's ranging from structured reports, modeling studies, and guidance on things like safe travel. And the second thing we did was through sort of organic decentralized support at the country level, which was course through our resident missions and regional departments, we deployed the experts the countries needed at very short turnaround. So embodied in those experts was the knowledge that was required, and many of these were national consultants. So the story of how we did this and what was needed and how we responded is important to document and share because it will inform the future, this endemic phase. So let me turn to what I think might be happening in the next few years, starting from 2022 even. What might be this endemic phase of COVID-19? So an endemic virus is one that is constantly circulating in the population, perhaps at a low level or it's geographically contained, or even at a mass level like seasonal influenza viruses of different types. Some level of predictability is, I think, implied in the definition of endemic. But for COVID-19 to circulate, at least for a while into the future, it will need susceptible hosts. So the possibility of such susceptibility and endemic nature will vary country by country, and it will be complex to predict. And it is very likely that even with high levels of vaccine coverage, we may see some variants of SARS-CoV-2 virus which can circulate. So what are some other possible characteristics of this future world? While I think many individuals will have residual immunity from prior exposure and or vaccination, there will be some residual pools of the unvaccinated, including younger people. An endemic phase may also mean that there will be need for potentially annual booster shots. There's still a lot more research needed there. There may be a need for localized containment measures if there's an outbreak, as I think we see from time to time with measles in children in communities where the immunization rate is low or faltering. So how can we shape the knowledge agenda for this type of world that I've described? It will have to be adapted from the strategies that Dr. Kuchenmüller, Patrick, and our colleagues from the Republic of Korea have described. So the past is a prologue, but it is not the full story. There needs to be further adaptation. So the first point, I think the future must involve a brave new world when it comes to information sharing. We need a lot more coordination between countries and global institutions around data sharing on what is happening as countries approach some level of endemicity. And existing tools such as online COVID-19 global trackers, and I think we've all used them, information sharing on vaccination scale and efficacy, especially against emerging variants and established variants, will be needed for a long time. And these could all be improved by institutionalizing these tools rather than depending on informal arrangements. And by institutionalizing, ADB will continue to support that agenda. Especially, we can work with the proposed ASEAN Center for Public Health Emergencies that Patrick mentioned, as well as other institutions. So that's the first point. The second point is that ADB must support countries to develop their own robust knowledge ecosystems around pandemic preparedness. This involves an ecosystem made not just of government institutions, but involving local academia, local community organization, especially as we try to capture information at a decentralized granular scale. And we need to involve local municipal governments and provincial governments. The decisions of the current response, the current phase, have been quite centralized. And even as we need global coordination with endemic COVID-19, we will need policy decentralization. We need knowledge systems that can support a lot more dialogue within countries on the choice around booster shots or the response to future localized outbreaks of a potentially endemic virus, etc. So our ADB resident missions have made a start on this kind of preparation and trying to decentralize the knowledge agenda, but there's a lot more work to be done and a lot more capacity that needs to be built. And third, the third point is that we as ADB must continue to invest in systems research and applied knowledge around flexible health security approaches, including using the tools of the age, digital engagement with citizens, with institutions, with the ecosystem, big data visualization that is itself democratized so that we do not have big data capabilities only in very large institutions, but we can try and push that down alongside policy decentralization. And finally, much better predictive analytics, as the course of the epidemic, as previous speakers have said, is going to be highly uncertain. So we must map out these scenarios of endemic COVID-19 and help our DMCs predict, plan, and prepare. What is sure is that with endemic COVID-19, we need to see it coming much earlier. We must be ready, and well-coordinated, transparent, real-time knowledge management at all levels will be critical to that readiness. So Swee Keng, I hope I've helped. Over to you, and let's continue. Thank you.
You certainly have, Dr. Arun. It's a pleasure to hear your thoughts about ADB's 3 agendas coming soon. Firstly, to institutionalize. Secondly, to decentralize. And thirdly, to build new tools for the digital age on how to manage knowledge. Ladies and gentlemen, those are the opening remarks, and indeed the comments are from our excellent panelists and also speakers. We have about 6, maybe 5 minutes left, and maybe it's time for me to move to the audience questions, and maybe just take one from the floor and invite all the panelists to have a conversation around this question. And the question comes from a Brian Kennedy Javier, or Javier. I'm sorry if I'm mispronouncing your name. Knowledge management, and his question, or Brian's question is, knowledge management plays a crucial role during a global health crisis. What advice can you give to developing countries, many of whom are member states of the Asian Development Bank, developing countries like the Philippines? What advice can the panelists and also the speakers today give to countries like the Philippines in terms of managing knowledge so that they can and we can respond better to the pandemics? I'm very happy to open up the floor, but if I may, maybe for initial remarks from Ambassador Chung about developing countries and advice to them. Ambassador Chung, over to you.
Okay, I'll be very brief because I will propose something that nobody has talked about. I'd like to advise the developing country to focus on strengthening the authority of the Center for Disease Control. For example, the professional body must have enjoy the respect of the society from a non-political and professional point of view. In a way, luckily, the Korean KDCDC, in a way, maintained a certain level of professional integrity and enjoyed the social respect apart from the politicization. So you have to stay away and very careful not to politicize the professional knowledge. And the custodian of the health knowledge has to be respected, and the authority of the health knowledge manager has to be respected by the society. And of course, it doesn't come free. They have to work hard to enjoy the respect of the society for their authority as a custodian of a health knowledge manager.
Ambassador Chung, thank you very much for your initial thoughts of professionalizing and depoliticizing the knowledge agenda, also organizations like the CDC. Other panelists, perhaps, maybe we'll go in this order, if I may, Professor Choi, and then to Arin, and then to Dr. Kuhn-Muller to close out. Professor Choi, over to you.
Okay, thank you. So the Dan Augustine, Mr. Brian Kent, he asked to some question about to me in the chatting the window. So he asked to what was done in the health expert participation in the policy level in the COVID-19, and what kind of advice to some of the developing country, Philippines as well. So I believe that the key success or quite the good performance factor mechanism against the COVID-19, the national level is deeply depends on how to effectively link the scientific evidence, the opinion of expert to policy level, decision-making structure. In Korea, the health expert has participated at various levels, the highest level under the president and the Ministry of Health level, and the Korean Disease Control Agency and the regional health service center. At the various stages, the levels, the health experts that participate in the areas. That was quite good. However, in Korea case, some of the medical experts that some participate in the policy, the highest level of the policy, the participation was not so effective at the first stage, especially. So there was some problems. And some countries they successfully adapt to make mechanism to intellectual the scientific evidence to the policy level, the highest level. It was quite good. It is kind of the reference. So please think about that the cases. Thank you.
Thank you, Professor Choi. Over to Dr. Arin and then to Dr. Kuhn-Muller to close us out. But I'm so sorry that we're running short of time, so perhaps a rather quick remark. Over to you, Dr. Arin.
Yeah, so very quickly, I think to the case of Philippines, what we are seeing is that the reform agenda there is very much about the universal health coverage, reforming payments and structures. But what's perhaps needs to be emphasized even in the Philippines is can we reinvest into public health and especially into pandemic preparedness and response? And that agenda, of course, is high right now, but how long can we keep that at the top of the agenda? And it is extremely dependent on central government investment, has always been. But I think in the future, with decentralization and more resources for the local governments, they must invest in their public health capacity, or else we will lose the opportunity that this crisis represents. Back to you.
Thank you. A great point. Dr. Kuhn-Muller, over to you to close us out. Advice to developing countries.
Thank you so much. Well, it's very much building on the responses of the previous speakers already, but we have heard from Ambassador that it's important to have a disease control tower that is socially accepted within a country. We have also heard from Professor Choi that it's highly relevant to make the connections and strengthen the connections between research and policy. And I think going back to my intervention earlier, that it is really conducive if a country has a well-functioning advisory body that can bring systematically and institutionally research to policy to inform a crisis response. So that would be my final wording. Thank you so much.
Thank you very much, ladies and gentlemen, to our esteemed panel of excellent speakers. The title for today, if I may return to it, is to institutionalize knowledge management. And bearing that in mind, I think we've definitely achieved the objective of today's panel, which is to learn lessons from South Korea and also from the World Health Organization and the Asian Development Bank about how we can institutionalize the management of knowledge, not only for COVID, but for also future pandemics. Ladies and gentlemen, thank you for bearing with us for the last 1 hour, and sorry to end just a minute ahead of time, but the floor is again over to Bayarma from the Asian Development Bank to close us out. I thank everyone again for their participation and for your interest. I wish you all a good weekend.
Thank you very much, SK. I think Bama went already to the next session, which is on futures and foresight, an important skill when we think about the next pandemic. That's a collaboration with UNESCO. So I take her role now to thank everyone here for the great collaboration, for the clear messages. And we're looking forward to more work, especially with WHO, on evidence-informed policy making. Thanks also to Ambassador Beckman Chung, Dr. Cho, and of course, Patrick and Aaron for being here today, and for all collaborators, and to you, SK, for managing the time so well. Thank you.